Welcome to the Heart Rate Variability Podcast. In this podcast, we discuss the exciting science behind HRV and how you can apply it to your own health and the work that you do. Just a note, this podcast does not replace medical advice, and if you're going to apply this to your own life or others, please consult with a medical provider. Thank you and enjoy the show.
Hello, everybody. Welcome again to another episode of the Heart Rate Variability Podcast. Jeff Summers here, along with my co-founder at Optimal HRV, Matt Bennett.
Hey, Jeff.
Matt, happy Friday to you.
I know, we're back on the Friday schedule. It feels a lot better than a Tuesday. So
this is very true. Absolutely.
Recording this on Friday the 13th in the craziest year ever, and knock on wood, but it's 2 p.m. our time, and I don't think the asteroid is hit yet. So
that's right. Exactly. Hopefully it's not on its way.
Yeah. Yes.
Just talking about the upcoming holidays. Hard to believe we're under 2 weeks to Thanksgiving, man.
I know, we're there.
Not a lot of travel going on with everything happening in the world, but
exactly.
I'm sure everybody's looking forward to a couple days off.
Absolutely.
That's it. So we, one of the things that we've sort of briefly touched on in some of the podcasts so far, and certainly something that you cover in the book, is HRV and how it relates to a team.
Yeah.
So, really we've been focused on the individual and why HRV matters and what you can do to improve it, and, all the neurobiology around what HRV is. And I think everybody understands from an individual standpoint how important it is, but nobody really out there is talking about from an organizational standpoint,
right? From
a team standpoint, from a leader standpoint, how you can incorporate HRV into your day-to-day activities with other people, and not just for yourself, looking at your own reading every morning and figuring out what that means for you, but also collaborating around a team or an organization's HRV. So, I guess let's start there. I think this is something we're both passionate about, something that we saw as a gap in the marketplace, and one of the main reasons that sort of led us to build Optimal HRV. So maybe as somebody who used to lead, caregiving organizations, why was this so interesting to you?
Yeah, well, one of the things, and I mentioned this probably with the last episode with self-care, is the primary for my training work, in my professional life as well, really looking at healthcare, social services, education, criminal justice, like those have been my focus areas, and they dominate the top occupations for burnout. So part of that message to me is we're not doing something right. Like when our physicians and nurses are number one and number two,
right.
There's something broke when social workers and people doing social services are number three, when teachers and principals, 4 and 5, lawyers, police officers, 6 and 7, these systems are broke. And
these are people that are supposed to be helping and in a position.
So the healers are sick,
Exactly. That's right.
And we've talked all throughout this podcast about, do you want, what if I just had this thought today is like, what if like airline pilots were number one? Like, would you want to get on a plane ever again? Like knowing the cognitive fog that burnout can put you in, the reactivity, the slow decision-making, prefrontal cortex, like, would you ever want to get on a plane again? I wouldn't, knowing what burnout is. And they can put their plane on automatic pilot, which I'm not going to fly a plane. It's way too complex to me. But, your surgeon doesn't get to say, hey, take over. I'm good,
Yeah, there's no autopilot for open heart surgery, right?
Yeah, and I've done some research. I mean, the times we're misdiagnosed and given an inappropriate treatment is actually not unusual in healthcare. There's kind of a joke in the healthcare arena. The most dangerous place to be is a hospital because of all the infections and stuff you can get. So we need our healers healthy. We need our helpers healthy. We need our educators healthy. We need our police officers healthy. And so, I had this interesting experience in a kind of a 5-year period, even though my undergrad was a little bit longer than that, is I did 3 years of graduate work in psychology. And then I wanted to move to Colorado, but I was also looking for an MBA program. I'd been promoted to leadership, realized that leadership was at least as complex, if not more so, than being a therapist, yet got promoted to do that without any experience or training whatsoever. And one of the things that really hit me when I started to really study stress and trauma and the impact it has on our minds and bodies, intellect, social intelligence, emotional intelligence, is that a lot of these models that have been developed, like total quality management or Six Sigma, in the manufacturing world, and I'm not saying manufacturing is not stressful, please don't get me wrong, but you don't see necessarily engineers up on that top 10 list. You don't see people working on a factory floor on the top 10 list for burnout. You just don't. I mean, that's statistically there in the research. And I'm like, okay, these models of management are just not working. They're not working within the context of occupations that deal with what I call empathetic intensity. When you have to give compassion, when you deal with one of the labels that get put, toxic emotions like hopelessness, worthlessness, anger, frustration, anxiety. When you're a teacher and you're worried about your kid going home because they might get abused, or they're sleeping in a car, or the anger that a police officer might feel, or a family lawyer who deals with divorce all day. This empathetic intensity, as I call it, we know emotions are contagious, and these occupations are just getting destroyed. And so as soon as I kind of learned about trauma, I just graduated with my MBA, and I 2000 to 2002 in that master's program, and then 7 years of undergrad and graduate school in psychology before then. I'm like, wait, okay, I sort of have some expertise in this. And so I really started to think a lot about, okay, how do we take all the stuff in the business literature? Because getting good outcomes, being efficient, being productive is still important. In fact, I'd say is incredibly important in healthcare. You want high quality, you want efficiency, you want all those pieces. But how do we deal with the trauma and the stress that walks through our door each and every day? So, our previous podcast about self-care is part of that equation. Each individual has to take responsibility to bring their best self to work each and every day. However, and unfortunately, some of the organizations I work for were great examples of this. If you were a superstar in self-care, but had to come into a dysfunctional workplace every day, you can't stay healthy. You're going to mirror that dysfunction. We call this parallel processes in psychology, where if you're in a system and there's dysfunction in the system, that the whole system eventually will become dysfunctional if there's not enough kind of protective factors to confront, and that dysfunction doesn't get addressed. And so, I've spent the last, really you could say, God, this is painful to say, really 25, 26 years, I don't know, maybe, pretty soon it's going to be 30 years. Because I started thinking about this in undergrad, like, how do we create these healthy systems? And so, so I've had this thinking, I've done training on what I call trauma-informed leadership, really a focus as much on organizational wellness, healthy relationships. How do we manage stress in a way that also promotes really good outcomes as well? But my same frustration was there, is how do you measure the health of this group, this team, this division? How do you measure that? And the answer to that, and I'd love to get your experience as somebody that's been in the business side of the world, because you may do it better than we do, because we're not great at this in the helping professions, is we do a survey every 6 months. And, and I'm a big fan of like Gallup 12, you're a nerd in the business if you got your favorite employee engagement survey. And I'm a huge, I will preach the gospel of Gallup 12, which, if you're not familiar, the Gallup survey has done this, and they found 12 key questions that have been just extremely well researched. So I've got my favorite like survey, but if you do that every 6 months, boy, it's not enough.
It's not
Plus,
enough, and there's still bias in a survey,
part of it is, and I want to throw it over to you to hear what your experience has been. Is part of it when I go into like hospitals or I go is like, what is your return rate? Because almost like your return rate is going to tell me as much as anything else. Because if I see a return rate under 50, I'm like, your people don't even think you're listening to them, right? So not only do you don't really have good data to work with, you also, your data is people have given up on you. So it's like, it's this interesting thing. So I would love to hear, Jeff, as you work in these really sexy tech startups, like we all dream about being.
The reality is probably a little different than what you have in your head.
Your foosball and hot tubs and like custom cooked meals you all get. But I'm interested, because one of the things that surprised me is, how you get treated sometimes in these organizations. So I just kind of wonder, like, what's the focus been on your health and well-being in your experience?
There has been none, to be quite honest with you. Thinking back to all my experiences, and my experiences have typically been, 50 person or less type organizations, and then we get acquired by a very, very large, multi-billion-dollar software company. Yeah. And that's happened multiple times in my career, and the difference is stark, and it's very interesting, because there's the talk and the walk.
Yeah.
And in the startup companies that I've worked for, that's not something that is really talked about. People are the goal is to build the company. It's to succeed. It's to make the product as best it can be, to sell as much as you possibly can, and everybody's in it together, because there's I believe, a sense of belonging in the general process of working for a startup company. But there's no talk about employee wellness. We don't have those 6-month surveys. I mean, I never took a survey
really
at any of those companies. No, I mean, I don't think I've ever had an annual review in any of these companies, other than when it's me that scheduled it with people that I'm responsible, for. But with my managers, I've never had like a official annual review process. But we didn't need, typically, I don't want to say we didn't need it, because everybody needs it, but it wasn't nearly as big of an issue as when we get to these multi-billion-dollar organizations where they talk about wellness and they talk about employee mental
before
health.
You go there though, like, what do you think? Because I think folks in my world totally have this. When we say tech startup, it brings, we think of like Hewlett Packard or Apple in their garage in the Silicon. I just like, is there not I would think in that environment where it's such a crucial, and maybe many ways, like the energy or the like the health of staff, knowing that somehow is going to relate to the quality of product you're putting out. Well, where's the disconnect there?
It's so a couple of things. It's a hugely missed opportunity, for sure.
Yeah.
When you think about the people that are leading these organizations, they're often people who build software. They may not have experience as managers. They may not understand corporate culture. They built a really cool product that is very technical and does cool things for large IT organizations, and then they got somebody to fund them, and now all of a sudden they're hiring people to go do things, but they don't have that experience. Your training is a great example of something that would have been hugely beneficial for them. Certainly missing a huge opportunity there, and something that would have been well received. But the interesting part is you then get to these large organizations where they do talk about it, and they do send out your surveys. It's a lot of talk. It's, you don't really know what's going on, that they're actually doing anything about the information that they're extracting from the surveys, or, it's great that we've got trainings on or resources, but Yeah, they're not, there's only maybe been one that's actually sort of walked the walk, even though they're all been really good at talking the talk. So, yeah, it's just a shame. It's something that I think COVID has really brought out to the forefront. Everybody having to work remotely. Now, all of a sudden people care and people are talking about it and hopefully actually acting on it. But I've never in my career and all the organizations I've been at felt like this was actually a thing.
Yeah.
Where they cared about it and that they were following through with and genuinely did it. Now, I do know people who have been at startups that were, I haven't been part of the, Silicon Valley startups that, had huge amounts of funding and that kind of stuff. Ones I've been a part of have been very successful, but very bootstrapped. So there are those examples out there, but they're few and far between.
Yeah. It's fascinating because, and when you start something in the year 2000, of course you think everything starts in the year 2000, but like, it was an interesting time to be in my MBA because, there were a few, like First Break All the Rules, which was the first book written on the Gallup 12, and a present that I gave to any of my friends that ever stepped up into a management position for probably 10 years. That was the gift that I sent them because it really showed that high-performing organizations were healthy, that people feel cared about. They felt valued, both by their supervisors. One of the best questions ever. And for me as a psychology student, I just sat in the MBA class and watched my accounting professor have a seizure when this book came out because, one of the best predictors of engagement was whether you had a best friend at work. And tell that to an accounting professor. It's like, well, why does having a best friend at work lead to better revenue and sales? And they're just like twitch. There wasn't that sort of thinking. And then I thought that Jim Collins with his work, Built to Last, Good to Great. Good to Great also came out around that time. I think 99 that came out. Built to Last was 99. And then, he was putting out one every 2-3 years. And it just showed that these excellent workplaces were healthy workplaces, that leaders cared about the well-being of their staff in a strategic way. And it's just interesting to hear that here now, 20 years later, that still kind of isn't necessarily the norm everywhere. And that to me is a fascinating thing that maybe HRV, I think part of our hope here is that, okay, we can quantify this and we can, for the first time, in the history of management, we can put a number on wellness. And again, just like we were talking about, whether it's a therapist, whether it's a physician, whether it's a teacher, then we can put all that research on top of that, right? So if your staff, and this is where I think I can just nerd out for hours on some of the teams we're starting to work with, rolling this out is, we sort of created this initially for if you think about a therapist or a physician and their patients or clients, but boy, that works good for a manager and their staff as well. And so, you look at these dashboards and you just kind of get a glimpse into people's life, but you also have this collective group that has an average HRV score for that day. And we're starting to get, now that we're on our kind of getting to the month, level with these, how's that group compare to the average population norm for the group, taking into account all their ages, genders, how are they performing against that average number? And all of a sudden you get a depth of information is we don't know these people. They've been nice enough to let us see their data. But I feel like I'm getting to know so-and-so, especially if they put tags on this, that caffeine kind of gives them a little bit boost after they, so now as a manager, what I never had, and those 6 months apart surveys never gave me is, how's my team doing today? How's my team doing today? And in some ways, I don't really care about the individual score on a daily basis unless something big's going on. But what's my group average? How's my team doing this week? and really tracking that as well. I will scream at the top of my lungs is no employee should be punished or disciplined for their HRV score. If you do that, you're not going to, that's not what we're about. However, I really believe if you look at all the research around, staff wellness and performance, I really believe that this is a great metrics of the effectiveness of their manager. Now, I'm not freak people 100%. Out with that, but I really believe that, hey, now it should be one metrics. It shouldn't be the only metric, but boy, now that we can start to compare different teams. I mean, we've been talking with some call centers actually, and it's like, well, how's working in the basement versus working on a floor with windows? The questions you can start to ask to this, I think, are just fascinating.
Yep. Yeah. That's right. I mean, just differences and shifts. I mean, we've worked with all kinds of different people in different, capacities. And one of the things that I want to bring up, Matt, because it comes up every time, and it's something that you sort of have to talk about is privacy.
Yeah.
It's important, right? So you're an employee and your employer is saying, hey, I've got this really cool new benefit.
Yeah.
Take your HRV score every day. And you're going to know about your wellness, and you're going to understand, your autonomic nervous system better, and how well you're handling and recovering from stress. And it's a benefit. Okay, great. But I want to see it too.
Yeah.
Whoa, what do you want to see it for, boss?
Yeah.
Why does your boss want to see it?
Yeah.
Hold on a second. Is this for me, or is this going to help me, or is this going to hurt me?
Absolutely.
So we've talked through this with every prospective customer we've had, and it's really a great conversation to get into from an organizational standpoint.
Yeah.
But how do you answer that question?
So it's interesting. One is like when I talk about, hey, you put this on your patients, clients, students, no hesitation at all. Oh yeah, this would be great. And you can also use this for team and org. Oh, I'm not sharing my HRV with. So there's this dynamic that's going on, and I've got to wonder out loud is what's that saying? Like, if an organization says, "Hey, we want to really focus on your wellness," and your staff say, "We don't trust you enough to give you this data." I think there's a question. Again, HRV allows you that. And some of this is like, if nobody trusts you to give you your data, I think it's sort of like, hey, we only got 30% of the surveys back when we handed out the 6-month survey. It tells you something. But I also think that there's living in a time where, I sometimes say something out loud to my wife. We've got listening devices in our home. Like I won't say the name because it will set off a million listening devices.
Music will start to play, and your smoke alarm will go off.
Variability by Matt Bennett. But no, I won't do that. But it's like, and I think I must type it in somewhere, and then it shows up on my like Yahoo email advertisement, and it populates my Facebook. Like, so there's a fear of, and there's probably a fear of, okay, well, what's this optimal guy's going to do with my data as well? So part of that, I totally, and we don't want that to be a thing. So we've worked with some organizations where, hey, we're gonna do reports for you on a regular basis. I think as we develop and more people ask for it, it might be automated within our system. But I think, for a lot of folks, I understand, and the interesting thing, and this again is I see, as we progress with our versions is, I don't want a manager looking at daily scores. I just don't think that that's good, because if Jeff goes out and he might have a few too many margaritas, but he shows up for work the next day, pulls his weight, meets his job description. It's not my business to know Jeff had a few too many. You show up.
More likely these days, it's Jeff's 1-year-old didn't sleep at all, and
I'm thinking back
And
when
so
we used
my
to go out on
HRV is,
Tuesdays.
I was
Jeff.
going to say, I wish that were still the case,
Remember occasionally we go out like Tuesdays and yeah.
Absolutely, but the same result, is a poor HRV score. And so how do you make
Absolutely.
decisions or judgments on that without, knowing what went on the night before? And so
yeah. And if you looked at I think this is just interesting to share. I've been fascinated by the last 2 weeks. I shared last week that my HRV scores really tracked with the election results, which I felt was, it's fascinating to get that. My wife also brought, it wasn't COVID, but being a first grade teacher, there's more germs than just COVID at the school. So she brought home this nasty virus of some point. And I'm going to knock on some wood here, but been fighting it off pretty well. But I've been in red the last 2 days and have had headaches. I haven't quite gone full in and I got green today. But if you were like my boss and said, ooh, Matt's been in the teens a couple of days, Matt, what have you been doing? Now, probably not your business, right? Because now if I'm coming into work and everybody's sick, there's some questions around that. But the key thing is like, what about, I would say what I hope people would do is be comfortable sharing their weekly averages, sharing their monthly averages. And it's also funny, Jeff, what I've found is give someone a $20 Starbucks gift card and they will give you everything. Like here's my medical records for since I was born. Like, here's my social security year. Here's my birth certificate. Like, a $20 Starbucks gift card. Like, is amazing what we will do for a $20 Starbucks gift card. So part of this is, you're giving somebody something. So to do that, but it's something to think about. One is if everybody's hesitant to share their information, what's that telling you as leadership? But also, like I said, I don't really want managers to be looking at daily scores, like to track people over weeks gives you a much better information. Because Jeff might not get a good night's sleep on Tuesday or Wednesday, but is he pulling his weight? Is he able to recover from that? Am I seeing that his weekly average isn't going down too much from maybe a couple bad readings? So there's workarounds for this. Where I also see this might be, there's the other argument with it as well as, we talked, one of our early clients before COVID hit was going to be a police force. And, when I did training with them, to hear some of their stories were just, what these folks dealt with just blew me away. The intensity of it, what they went through. And, when they go through these critical incidents, as they call them, they got to go to a therapist to get cleared, but they all told me that they know what to say to the therapist to get out of it. So when you got someone going through something like that, a work-related, I think that's important, a work-related trauma, so to speak, seeing that daily average so you can support them back to full recovery might give you some really good data to help it. So there's a lot of gray area here that we are working with. I think some organizations, we were dealing with one, shelter, and he's like, all my staff were doing this every day, right? I'll take them out to lunch or whatever, and we'll have a big competition. This will be fun. Other folks is like, they think this is going to be black ops, deep state coming in. There's no way they will do it.
They're going to get fired, right?
Yeah. So the challenge to us has been, how do we create the flexibility? And I think we've done this successfully to say, hey, the norm, the starting point is to keep an eye on those 7-day averages. And, maybe looking a little bit deeper if somebody's going through a hardship, but having that flexibility to really think what this might be. And I imagine as we get more and more organizations, some will probably want to start out with a very generalized scope. So give me the team health, right? I'm not even individual things, which gives you a great metrics, where your team is. And probably for a manager, the most valuable metric is that team populated data set, and how that compares to their baseline and population norms really gives you an amazing, in fact, I can't think in any of the books I've read a better measurement of team health. So then you can expand that down to the individual level if there's trust there, if incentives makes sense. We've talked about maybe giving discounts on health insurance premiums. We hope to prove this to health plans that, hey, people focusing on their wellness every day is going to lower cost as well. So there's a lot of kind of gray area to start to define as we move forward. But, I just think if you look at that dashboard of here's where my team is today, here's where my team at this week, here's where my team's at this month versus, again, population norm, all-time average, it's the best measurement of team health that you can have. And there's all this volumes of data that we can put on top of that. Is a healthy team with a strong HRV is going to perform better. The sales are going to be up, revenue is going to be up, stock prices are trending in the right direction. That's what the Gallup and other studies have given us is, hey, if you create a healthy, engaged workforce, everything trends in a positive direction.
Yeah, I mean, it really just gets back to productivity. And when you look at your job, productivity could be selling something. It could be successful surgery. It could be, successful interventions. Whatever it might be, the outcome is the same success. And higher productivity leads to more success, whatever your metric of success is.
Exactly.
So HRV can help you understand that, and it can help you drive towards that.
Yeah. So, whatever you're doing, most jobs, you need your prefrontal cortex. I spent a horrible summer in a factory. I got so much respect for people that work in factories. Boy, it about drove me crazy. But even that, productivity, efficiency, errors, everything was about that. So even some repetitive tasks, we know that if we don't do a high quality, high productivity, that everything on the line slows down. And, so I can't think of a job where it doesn't matter that you're not your best self each and every day.
That's right.
If our audience can name a job where that's true, I'd love to hear it. But, it's organizational wellness. If nothing else, a healthy employee, a content, engaged employee is more likely to stay. And we know turnover is incredibly costly. So, yeah.
That's right. Yeah. I mean, this is thinking back to the first podcast and how far we've come, from really understanding the science and biology and neurobiology around HRV to, understanding how it affects productivity and corporate culture and organizations. I think it's cool. I think it speaks to the importance the biometric has in everyday life. Absolutely. Yep. All right, Matt, let's go enjoy the weekend. Even though everything's generally closed or the capacity is so small, you don't feel good about going out and really doing anything. We can at least be with family and maybe a friend or two.
Exactly. That's the hope. And maybe my wife will go through a drive-through and get dinner tonight. That seems to be the big night out at the Bennett house is maybe Chipotle. So we'll see. We will see. Her school's shutting down again, so it's back to that.
Back to that.
We'll see
around the world are watching.
I mean,
we've got podcast followers around the world, and
yes,
people in Europe and other places are on pretty much full lockdown. Other than just the basic services. So just
stay
the
healthy.
Way the world works right now. Hopefully that vaccine comes sooner than later.
Absolutely.
All right, take care, everybody. Thanks for watching.
Have a good one. Thank you for joining us for this episode. If you're interested in more information about HRV, please visit us at optimalhrv.com. Also, if you visit optimalhrv.com, you'll be able to sign up for our email list and download our free ebook, Healing with HRV. Thank you for joining us, and we'll see you next episode.